Good morning and welcome back. It's about 14 minutes before 7 o'clock. The statistics are staggering. About 6 times as many more women die from heart attacks than breast cancer, yet so many are unaware of the signs and symptoms. So here to discuss with us this morning is Dr. Sam Setty, Gunderson cardiologist. Dr. Setty, thank you for joining us this morning.
You're welcome.
So we're talking women and heart disease, and I found it interesting. There are some key features that differ for women than for men when it comes to looking at heart disease. Can you tell us about those?
Yeah, it is very different, and this is something that we have learned in the recent years. In the past, we were looking for a typical chest pressure with sweating and shortness of breath as a sign of having heart problem or a heart attack in both men and women. But over the years, we've learned that women kind of present a bit different. The symptoms are not so obvious. It can be very subtle, like a twinge in the chest, to all the way to the full-blown heart attack that we are used to. So when women do have symptoms of trouble breathing, fluttering in the chest, or maybe a subtle twinge, they need to seek medical attention, as we have realized that these could be symptoms of heart problem that is underlying. And like most women, we like to put away our symptoms thinking it's nothing till it's too far ahead.
I found that interesting as well in some of the reading I was doing this morning on it, that there's a lack of public awareness when it comes to women's heart issues, yet it affects so many. Is there something that more women need to do as far as talking with their doctor about this?
Sure. Well, after age 50, we recommend that everybody needs to get an annual physical examination. So at that time, I would recommend that everybody discuss this with their primary doctor. If they're feeling something different that they're not used to, that could be related to the heart, just do not hesitate, talk about it. Maybe we'll find something out of it. In addition, we also offer screening like calcium scores, maybe a treadmill test, cholesterol screening, and these are types of tests that can uncover something that is subtle and hidden.
And of course, when we talk about any sort of disease, prevention is always key. What are some quick things that people can do, not just women, but men and women can do to help prevent heart disease?
Sure, that's a great question. Prevention is always better than cure, and the best thing you can do is going back to the basics: diet, exercise. There is nothing what is natural to the body. So walking alone for about half an hour to 45 minutes every day goes a long way in preventing heart problems. In addition, eating healthy, balanced diet, as recommended by any organization or any dietary board, it is good.
It's as simple as that: diet and exercise. Dr. Setty, thank you so much for joining us this morning.
You're very welcome. Thank you.
And we'll head to break with a look at what's coming up on Good Morning America.